Thanks, Eunice, and good afternoon or good morning, everyone. And thank you for joining today's webinar, How State-Led Housing Initiatives Can Break the Cycle of Criminal Justice Involvement. We'll get started in a few minutes to allow for additional sign-in past the half hour. Good afternoon, everyone. We're very glad that you can join us today again for the webinar, How State-Led Housing Initiatives Can Break the Cycle of Criminal Justice Involvement. And please feel free to introduce yourselves in the chat box and ask any questions there, as Eunice has indicated. And to begin with, my name is Thomas Coyne, and I'm a Senior Policy Analyst here at the Council of State Governments Justice Center. And I'll be moderating today's webinar. I'm joined by Zach and Carla from the Colorado Department of Local Affairs, as well as Megan and Rachel from Cuyahoga County. And they will be introducing themselves further as they speak and share about the work going on in their communities. So today's agenda, we'll have a brief overview of who we are, what the Justice Center has observed across the states right now. Today's speakers will share their examples from the field, and we'll conclude with discussion, and I'll leave you with a few resources. So to begin with, we're the Council of State Governments Justice Center, a national nonprofit organization, and serving state officials in all three branches of government. And how we work is bringing people together, such as by this webinar today, to hear from experts and practitioners in the field. And our broad goals, which you'll hear today, how housing plays a role under each of these goals, actually. And again, we're brought together today through the Justice Mental Health Collaboration Program, which supports cross-system collaboration. And specifically, this is done through the Bureau of Justice Assistance at the U.S. Department of Justice. And so what we're seeing across states currently. First and foremost, as I think, especially in the housing sphere, always put front and center, we have a lack of affordable housing in the United States. And we will have the eviction moratorium coming to a close later this year. And without rental assistance, this may prove a large challenge. And as we saw during the Great Recession, whenever new housing slows down, whenever new starts to developing new housing slows down, there is also that reverberate for a long time to come, as we felt over the last decade when housing starts slowed down during the Great Recession, and how the affordable housing crisis took off from them. And we know that people with criminal records face additional barriers. And from states alone, we know through the Collateral Consequences Inventory that there are at least 1,000 restrictions just at the state level in housing. And this doesn't include additional restrictions through public housing authorities or that landlords might have. And this really is a challenge, especially when looking at the competition that exists at the local level in prioritizing people for what rental assistance and what affordable housing currently exists. and particularly with people with criminal records already facing stigma in the community. And so we know that the number presented before you, that this is certainly an undercount. But we know that many people that are leaving prisons and jails are subsequently experiencing homelessness, and that this number, both as county has gotten better, but also as the years have gone by, that this number hasn't decreased any. And I suspect from what we're hearing from both state governments and local officials that probably this year that number is also increasing, unfortunately. And you'll hear this in more detail, actually, from folks in Colorado and from Cuyahoga County. But the literature suggests that housing can help with reduced contacts with law enforcement and fewer returns to jail, as well as acting as a stabilizer that helps people connect with the outpatient community-based services that help provide stability in the community and can really help make a difference in people's lives. And we're seeing states step up to the plate. And so first, in Alaska, what we've seen is that 2 state agencies have been able to partner together and really leverage both their funding as well as their ability to identify people to help prioritize rental assistance for people who are on probation or parole and who have low incomes. And in Oregon, through work both by the state and really a bipartisan effort, and with support by staff from the Council of State Governments Justice Center, the Justice Reinvestment legislation last year really brought new permanent supportive housing to people who've been cycling between systems. And this is I think, a fantastic example of ways that people are trying to reinvest towards these both upstream and downstream to try to make sure that people are in housing and also that people are exiting to permanent stable housing that are really then positively affecting criminal justice outcomes. And in Pennsylvania, we're seeing savings from Medicaid are being reinvested in developing new housing. And some of the work by the state has allowed then counties, such as Montgomery County specifically, to use these reinvested funds to prioritize developing housing for people at the local level who are diverted from or leaving jails. And another way that states can provide this kind of flexibility to local jurisdictions to really both hit their local priorities and still bring those very needed housing resources to folks that are cycling in our systems. And now I'll be handing it off to Zach and Carla from the Colorado Department of Local Affairs.
Terrific. And can folks hear me all right? Wonderful. Okay, so I want to thank you so much for having us. We are really excited to have this opportunity, and so we're going to be talking about how we are working to end homelessness for individuals with justice system involvement. My name is Zach Schaffner. I'm our Supportive Housing Services Manager.
And I'm Carla Coney-Eves, the Homeless Program Specialist for the State Housing Voucher Program.
Terrific. So we are going to talk, if folks can move through the slides, we're talking about making homelessness history in Colorado. So one more slide, if that's okay. Terrific. And so I always think it's helpful to actually have real examples. So these are real participants in some of the programs. Got their permission on taking their picture. They're okay with it. We got the release and everything. And so our goal in Colorado, outside of just those with justice system involvement, is we want to ensure that everyone has a safe, stable, affordable place to call home. In order to do that, we need to create a broad continuum of housing solutions to ensure that homelessness is rare and brief when it occurs and no one gets left behind. What that means, I think, practically is that we know that new individuals will fall into homelessness. We want to have the systems and structures in place to ensure that if they do, that homelessness is short in duration, rare and brief. But in order to do that, in order to have this future where homelessness is room brave, we know that it's essential that we create the partnerships to ensure those with justice system involvement who often face very complex, difficult barriers to housing stability, that they have access to that continuum, and that continuum meets their needs as well. And if we can go to the next slide, if that's okay. Terrific. So part of this, and I always think it's helpful when we talk about this continuum, we don't want to prevent the conversation from including these key goals, right? We want to stop homelessness before it starts. That's the big system work we're trying to do. We want to identify folks who are at risk and ensure they're safe, and we're going to talk about that dynamic prioritization in just a bit. We want to connect with the folks with the right resource, and we're going to talk about that a lot. Not every housing resource is the best resource for every individual. We want to be really deliberate and strategic in how we match folks, and that's a big part of the work we're doing. And then we also need to do that, big picture structural solutions. We know that's part. If we want to get to a place where we're making homelessness history, I know it's a little corny, but I like the double entendre there, right? We're going to make it history. It's gone. We're also historic accomplishment. We think we're really funny in Colorado. So part of those cross-cutting approaches are the real-time data, being housing focused. We know that homelessness ends in a home, and building those cross-sector partnerships. Next slide.
So some of those solutions that Zach was talking about, there's multiple solutions to preventing and addressing homelessness. And the solutions that we pair people with just depends on their individual situation. So the factors contributing to homelessness, the barriers to housing and housing stability, the length of homelessness. So for example, if someone is at risk of homelessness, we're looking at prevention and diversion. So connecting people to those immediate supports to prevent them from entering homelessness to begin with. For most people who are currently experiencing homelessness, we're looking at street outreach and low barrier emergency shelters to address those day-to-day needs. And then there's housing-focused solutions, such as rapid rehousing and supportive housing, which Zach and I will focus on in this presentation. So with rapid rehousing and supportive housing, they're similar in the sense that they both provide rental assistance and supportive services. The key difference is the length of time that we're providing support. So with rapid rehousing, we're helping households resolve that immediate financial crisis, such as a loss of employment, that has led to that housing instability. So rapid rehousing provides the short-term emergency rental assistance and other supportive services to help them maintain or secure housing. Rapid rehousing uses a progressive engagement model where we're assessing the level of assistance needed each month and tailoring the financial assistance provided based on that need. And the goal is that over time, the amount of assistance is declining as households resolve that financial crisis and get to a place where they can maintain that housing minimum. Supportive housing, on the other hand, is for individuals with severe physical, mental health, and substance use-related needs. And providing, they need longer-term rental assistance and supportive services. So we're looking at individuals with severe physical, mental health, and substance use-related needs, and providing that long-term rental assistance in the form of housing vouchers, in addition to long-term supportive services to help them achieve that housing stability and other quality of life outcomes. Next slide, please.
So, that we need this full continuum, and we're going to focus on rapid rehousing and supportive housing today. And the reason why we're focusing on those particular interventions and why they make up the biggest aspect of the continuum for justice-involved individuals is that we know that supportive housing, referring to both rapid rehousing and permanent supportive housing, are incredibly effective at reducing the utilization of emergency systems. And so the data provided on this slide comes from a literature review completed by the Corporation for Supportive Housing. There have been numerous studies conducted on the efficacy of supportive housing as a best practice. It's recognized by SAMHSA as a best practice. What we're really realizing is, as we get further into this work, is that it's super critical that anytime you talk about supportive housing, that you're talking about housing first, harm reduction, and trauma-informed care. Those are the critical elements. And we're going to talk a little bit about sometimes those elements don't always play nice with folks who are under supervision and worried about supervision compliance. But we've started to figure out how to navigate those complexities because it does take some work and coordination, but it can be done because we're realizing that if we implement supportive housing effectively, we get to these fantastic outcomes on decreasing ER visits, hospital days, incarceration, and we increase housing stability. Next slide, please.
So over the last 8 years, Colorado has introduced several collaborative approaches that combine affordable housing with access to supportive services. So we as the Department of Local Affairs work with several partners, including Colorado Department of Corrections and the Colorado Department of Human Services. And this is all with the goal of disrupting cycles of incarceration, hospitalization, and emergency system utilization across the sequential intercept model. So I imagine most folks on this webinar are at least somewhat familiar with the sequential intercept model. But as a quick refresher, this model looks at how we are addressing mental health and substance use needs across all intercepts or touch points of the criminal justice system. So with these collaborative housing approaches, we're looking at how do we support folks with mental health and substance use disorders when they're exiting DOC facilities and reentering the community. So how are we helping them find and maintain housing and supporting them in accessing treatment so that we improve those health outcomes and reduce returns to homelessness and jails or prisons. Next slide, please.
So we've got the continuum of housing opportunities. We have the sequential intercept model. We've got to put it all together. And so this is a quick timeline of that it can be done. So in the last 8 years, we went from 30 to 700 plus. And so this is a quick timeline. I'm going to run through these programs, and this is what I think folks might be most interested in. So I want to spend a lot of time talking about how we actually structure these programs, where we started, and where we go there from there. So next slide, please. So where did this all start? It started with the Colorado Second Chance Housing and Reentry Program. So that was a partnership with Department of Local Affairs, our Office of Behavioral Health and Community Mental Health Centers that we launched way back in 2010 with assistance from the Bureau for Justice assistance and the Second Chance Center funds. So that really is what started all of this. It was a 2 years of rental assistance for individuals with dual diagnosis exiting state prisons in Denver and Colorado Springs. We served 3 cohorts from 2013 to 2016, and we showed significant positive outcomes in housing and recidivism. So this is what got us up and running. We got the Second Chance Center program started, and we said, okay, we know this supportive housing, which works for individuals experiencing chronic homelessness with those disabling conditions. We believe that the Second Chance Center program shows us that we can scale this out and learn a lot from it. Now, I will say, we learned a lot from Second Chance Center and the C-Sharp program. I think the primary one is that rental subsidy needs to be non-time limited. If we're going to do permanent supportive housing, we really need to have a long-term rental subsidy. The 2 years of rental assistance that we provided was not enough. For the individuals who were in the program, we ended up transferring them to a long-term rental subsidy. We also learned that not everybody needed C-Sharp. And so we learned that we needed to have that more diverse continuum that included different types of housing with different levels of supports. And then also it really, the type of housing that individuals occupied also sort of translates to acuity. And we'll talk about tenant-based and project-based in a little bit, but that also had a major impact on things. But this is C-Sharp, and this is what started it all. Next slide, please.
So then our state housing voucher program pairs non-time limited rental assistance with non-time limited supportive services. So these vouchers are for individuals who have a history of homelessness, a disabling condition, and who are high utilizers of publicly funded systems such as jails and emergency rooms. So the state housing vouchers have a similar infrastructure to the federal Housing Choice Voucher program, also known as Section 8. So households pay 30% of their income toward rent, and then the government pays the rest, improving housing stability so that even if a household loses all income, they're still paying 30%, which in that case would be $0. So it's a flexible rental subsidy that changes as a household income changes. The key difference with our state housing vouchers, however, is that we make the barriers as low as possible. So, for example, we don't have a criminal background policy. We don't even run that for the head of household. So we'll take anyone and everyone, no matter how colorful that background. And then we provide assistance with security deposits, which is often a barrier to securing that initial housing. And we also have a different termination policy. So we're doing everything that we can to prevent an individual from being terminated from the program. And these state housing vouchers are funded through the Marijuana Tax Cash Fund and the Colorado General Fund. Next slide, please. So these state housing vouchers can be tenant-based or they can be project-based. So essentially, tenant-based means that the voucher stays with the tenant. So the tenant can use that voucher in whatever housing they find as long as the landlord will accept the voucher. And if they move, the voucher stays with them. Project-based vouchers stay with a particular unit. So if a tenant moves into that unit, they get the rental subsidy. And if they move out, they don't keep that voucher, and whoever moves into that unit then gets that subsidy for that voucher. So for the tenant-based vouchers, we have several referral sources or referral networks to identify those households to be matched with the state housing vouchers. The Transition Specialist Program and the Momentum Program are both through Rocky Mountain Human Services. Transition Specialist Program essentially serves those with alcohol or substance use disorders who've had multiple 72-hour home, emergency, or involuntary commitment, or have been arrested or detained multiple times for incidents related to alcohol or substance use disorders. The Momentum Program is for individuals leaving inpatient mental health facilities and hospitals for transitioning back into the community. And this includes the defendants pleading not guilty by reason of insanity, those determined incompetent to proceed, and others who have a history of psychiatric hospitalization and significant behavioral health needs and barriers that have prevented them from successfully transitioning into the community. And then we have the Social Impact Bond, which is essentially an initiative that's aiming to both improve the lives of the people we serve, as well as show that we can save taxpayers millions of dollars each year by putting funds toward effective supportive housing programs rather than having folks rotate in and out of the city's publicly funded systems. We partner with a couple service providers through that Social Impact Bond. And then we have Division of Youth Services, or DYS, and the Division of Adult Parole through Department of Corrections, or DOC. So with those partnerships, we're working with youth and adults coming out of correctional facilities and supporting them with housing vouchers and supportive services through the clinicians at DYS and DOC. One thing that we learned with this is that in working with DYS and DOC, we don't have a continuous service provider because once the individuals were off parole and probation and no longer under supervision, they lost access to the clinicians at DYS and DOC. And so as a result, we recently changed our approach, and now we look for service providing agencies in the community outside DYS and DOC to be the continuous service provider. So we implemented a competitive request for application RFA process, and through that process, we allocated vouchers to Second Chance Center, Centennial Mental Health Center, and Homeward Alliance. So these three community agencies, they match their clients with the state housing vouchers that we allocate to them. And then they also provide the case management and other supportive services for their clients. So many of these clients are still coming from DYS and DOC, but by giving vouchers to agencies in the community, we can have that continuous service provider in place throughout parole or probation, as well as after they're discharged. So they have that continuity and long-term support that's often needed for housing stability.
Terrific. That's super critical, is that we learned a lot and we made that change for exactly the reasons that Carla outlined. So we also have our project-based state housing vouchers for folks. That the distinction is that rather than these vouchers being matched with an individual, we allocate them to a building and they stay with the building, and whoever's residing there gets the benefits of that rental subsidy that's paying the difference between 30% of their income and market rate for that property. So we have some really neat project-based projects. If anybody's ever interested in a tour of these buildings after COVID, we're happy to walk you through. And so I'm going to talk about a few of them. So Fusion Studios is a 60-unit supportive housing project in partnership with Colorado Coalition for the Homeless. What's really exciting is we partnered with our colleagues at the Office of Behavioral Health within the Department of Human Services, and they have 20 units at Fusion Studios, which was formerly a hotel-motel that we converted to permanent supportive housing for individuals who are in the restoration to competency process. And it's the first time we've provided vouchers, supportive housing vouchers, for folks who are in that restoration to competency. And it's just us trying to get further out on that sequential intercept model. So that's a pretty new program, but we're really excited about it because we want to serve those folks as well. Providence at the Heights, or PATH, is a partnership with Second Chance Center with Housing Choice Vouchers, and it is supportive housing. We also have our social impact bonds, so we have projects like the Sanderson Apartments with Mental Health Center in Denver with Housing Choice Vouchers. The other piece here that I think is relevant is the marijuana tax cash fund dollars, using that income for homelessness, super helpful. because those funds had a priority for high utilizers, we were able to say, we can use those funds for the construction and development of project-based supportive housing. But if you use those funds, we're going to ask you to do things like drop down the criminal justice background check requirements as low as you can go so that we can serve folks with justice system involvement because they're high utilizers. Next slide, please. So we've been talking about permanent supportive housing, so that's non-time limited, folks, and we've tried to transition to calling it supportive housing because permanent is a bit of a misnomer, right? Folks can stay there as long as they need to, unlike a transitional housing project that's time limited and they're sort of being pushed out. Supportive housing, they can stay as long as they need. I think what we typically say is that about a third of folks will stay from 1 to 5 years, a third of folks will stay from 5 to 10, and then some folks will stay there for the rest of their lives, and that's okay. That's great, stable housing. So this is rapid rehousing, and so this is a really neat program called the Colorado Rapid Rehousing and Reentry Program, or CORE, COR3. We're being a little creative, and we think we're smart when we name this program. So this provides the housing assistance and supportive services using the progressive engagement model that Carla talked about earlier. And so these are individuals who likely have lived in independent, stable housing in the past, and we know that with supportive services and rental assistance, eventually they'll be able to take over and they're paying that full rental portion themselves, and they don't need that long-term support. And so unlike a transitional housing program that says you've got 2 years or 6 months, we move away from that and we use the progressive engagement approach because in those instances, folks tend to do really well for, 23 months and 29 days or, 5 months and 30 days. And then all of a sudden they're in crisis because they face that sudden loss of rental assistance. So the progressive engagement approach is key in the rapid rehousing approach. Also in determining acuity, is looking at the rapid rehousing program serves a very particular population. And for folks who've worked in housing and homelessness, you may have worked with the VI-SPDAT, or the Vulnerability Index Service Prioritization Decision Assistance tool that's used to determine acuity for the allocation of vouchers primarily through the continuum of care process. What we did is we know these individuals are not coming into contact with our homeless service providers in the community. Later they are, but they're going to go through a lot of costly systems before they get there. So by providing them with assessing them while they're still in Department of Corrections. In the CORE program, we work with the facility parole officers to conduct a version of the VI-SPDAT that's specific to those with justice system involvement. So it's the justice discharge version of the VI-SPDAT. And so it asks questions rather about hospital use, it asks about infirmary use at Department of Corrections. And so that's a really great program. Right now we've got 220 participants, and we're working on a multi-year evaluation with the University of Denver, with the state and Volunteers of America. Volunteers of America, similar to how Second Chance Center and Homeward Alliance and Centennial, they're the external entity who's able to provide supportive services, do the in-reach, and coordinate with DOC. Next slide, please. So this just shows the map of where we have CORE right now. We started with 110 spots, and we just increased this. So we get pretty good coverage. It's not the full state yet, but we're always working to increase. And this sort of shows how long it takes for individuals to find housing. So rapid rehousing, it's using more of that sort of like a tenant-based approach, but it's not a formal rental subsidy, again, because we're using that progressive engagement approach. And so vouchers are a little bit more long-term. They follow voucher payment standards. Voucher administration is a whole process. With the rapid rehousing, it's a lot more flexible because we know that those incomes are going to change, and we need to be able to keep up with that. Next slide, please.
So throughout the implementation of these housing solutions, we're using dynamic prioritization, as Zach mentioned earlier. So we're using that dynamic prioritization to ensure that we're effectively allocating these limited housing resources to those who need them. So we partner with justice system staff and coordinated entry systems to use consistent housing assessments and administrative data to match individuals with the housing solution, provides the right level of care, and affords the greatest potential for long-term success. So, for example, Zach mentioned, somebody suddenly lost their job but was otherwise stable and doesn't need intensive support, then they don't need that long-term housing voucher. So they perhaps would be better matched to short-term rental assistance through the rapid rehousing program. Likewise, a youth exiting a correctional facility who was able to stay with their grandmother upon exit may not be in the highest need of a housing voucher compared to a youth exiting a facility who has absolutely no family that they can stay with. So we want to use our limited housing resources wisely and effectively match households with the housing solutions that will provide the right amount of care and support and set them up for success. Next slide, please.
And then also, we've done some great work with the folks from the Vera Institute looking at, so we've created this special rental subsidy, the state housing voucher, that's really flexible and doesn't have that criminal background. It's really designed to be hard to lose that rental subsidy. But that we still have, right, thousands, around 8,000 housing choice vouchers in Colorado that we have direct allocation over as a public housing authority, as a statewide public housing authority. And so we are dropping our policy, we are looking at our policies and procedures to allow individuals returning from incarceration to rejoin and reunite with family. So, right, the Housing Choice Voucher or Section 8 program has a couple very strict requirements on who cannot be served. So that's methamphetamine production in a public housing authority and individuals who are lifetime sex registers or on the lifetime registry. And so everything else, those individual public housing authorities have autonomy over. They can set those policies and procedures. And so I think it's really important. They don't like to share that, but they can. And so the Vera Institute was really helpful in us looking at our own plan and then also reaching out to public housing authorities in Colorado and saying, hey, you can drop these down because it improves all of the outcomes that we talk about when it comes to recidivism if we can have individuals return to stable housing rather than homelessness. And so creating access to those housing choice vouchers is super critical, and communities have a lot of oversight. They don't always use it, and it is political, but they can drop those barriers. And so these are sort of all the different approaches we're taking, expanding that continuum. We're still pretty new in this, but we're really excited about the partnerships we've created, and we're happy to share more for folks who are interested. But thanks so much for your time. We really appreciate it.
Hi, everyone. Can you hear me? Okay, great. My name is Megan Patton, and I am the Specialty Courts Administrator at Cuyahoga County Common Pleas Court. And today we're going to be going over a project initiative that we started over the last couple of years and to kind of give you an overview of how you can assist individuals that may be in your criminal justice system and your courts and also in the behavioral health world that are facing homelessness and housing instability. So with that, so just so everyone is aware, Cuyahoga County is located in Northeast Ohio. Our population size is about 1.24 million. Our largest and most known city is Cleveland, and our county is made up of mostly urban Cleveland with suburban cities. In 2017, our county came together and signed the proclamation to become a Stepping Up county. In 2017, we completed the sequential intercept mapping workshop with our stakeholders and leaders. And then soon at the end of that, we had 5 areas that we prioritized as need, with the 5th area being housing. What came out of our sequential intercept workshop was this definite approach that maybe the criminal justice folks and the behavioral health folks didn't have all the information about what each of our systems were doing. And so with that, we created a housing committee that was made up of our leadership and stakeholders from the courts, the shelter system, our COCs, our county jail, coordinated intake, behavioral health agencies, our public defenders, the APA, and we began meeting monthly. And this was really instrumental in getting the conversations happening. Something simplistic that we did is each month we met at a new place and tried to incorporate a tour in there. And in that, folks, we had, in those meetings, we had our leadership folks there and present, meeting each other, seeing the different places where our clients or defendants may experience, and together made a better collaborative approach. At the same time, we were lucky enough to obtain a technical assistance grant for housing through Stepping Up Ohio and also the Council of State Governments. And so these folks were really helpful in discussing the issues with us and having us kind of talk out how we can approach folks in our system that were frequenting our county jail, the healthcare industry, and then also the homeless shelter. And because of this, we started on a pathway of attempting to identify our familiar faces, and we're still continuing down that path. What I will say is during this time, what was the most important and most effective way to bring about change was education. At every opportunity when we could get the stakeholders and leadership together and to make sure that they were educated on what the different systems were doing was instrumental. And it actually moved our progress along a lot. So I would always advise that there's opportunity to bring these folks together and put experts in front of them and get them talking is really important. What we did identify through all the education was a program that was happening at the state level where they were providing permanent supportive housing to individuals. Oops, sorry, I just lost my slide. But where they were providing, sorry about this, my slide is going empty on my screen, but where they were providing permanent supportive housing to individuals that were coming out of our prison, and this was really important. This is an important program that we were working on, and with that, we were able to kind of present and leverage the success of returning home, and that was happening at the state level to our court administration, to our mental health court judges, and bring together all the partners in a series of meetings to create the program that we're going to talk about in a few minutes. And we, in order to create the program, we utilized state funding through our targeted community alternative grant monies, which is known as TCAP. And this is money that is provided to common pleas courts in our state at the local level, so they can provide supervision and provide treatment services to individuals that may have lower levels of felonies or are non-violent. And Thomas, can you let me know? My slide is blank on my screen, so I'm not sure what number is showing up for the participants.
Yeah, so you're on slide 37 currently.
All right, and can you tell me what the title is of that?
Yeah, it is Development of Returning Home Cuyahoga.
Okay. Thank you. So in order to create the returning home on a local level, we knew that we wanted to bring it through our common pleas courts. And so we focused, here it is. I apologize, everyone. So we focused our targeted populations on the referrals through our mental health and developmental disabilities court. Just to give a quick overview of our court, we were established in 2003. We currently have 5 elected judges that sit on our court, and we have about 609 offenders that are in pretrial or conviction. Our mission of our court is to serve all defendants who may suffer from a severe mental illness with psychotic features or developmental disability. Our goal is to break the cycle of them returning to jail and expand and focus on community-based solutions while providing effective therapeutic options and investing in treatment modalities. And then we have team meetings that are proactive through problem-solving sessions. And so we utilize the population within our mental health court to establish the referral base for returning home.
Hi, my name is Rachel Chetek. I'm the Associate Director of Forensic Case Management at Frontline Service, and I oversee the implementation of Returning Home Cuyahoga, the program that Megan was talking about. We just wanted to start a little bit with our Returning Home Ohio outcomes, just kind of to give an overview of the positive outcomes for our individuals returning from prison who are already participating in a similar program that our Cuyahoga program was designed off of. So our 2020 outcomes for Returning Home Ohio, which again offers permanent supportive housing vouchers in the community to individuals returning from prison who have a mental health diagnosis or are HIV positive and are returning to homelessness. So for that program statewide, there were 277 participants for 2020, and of those, only 3% had recidivism in the year 2020, which is pretty significant for that amount of individuals returning home. So this is statewide outcomes. The majority of clients remained in housing for that year, and of those that were discharged, the majority had positive discharges, and only a small percentage actually returned to incarceration. So that's really the reason why we decided to design the Returning Home Cuyahoga program off of Returning Home Ohio, is because we've had such success. And these individuals sometimes remain in housing 5, 6, I think the longest we have right now is 7 years. It's really engaging with them frequently in the community, making sure that they're feeling supported once they move in, and throughout time, if they have challenges with their landlord, working around those issues. You can go to the next slide, Megan. So we started this program right before COVID shutdowns happened. So it's been a bit of a challenge, but we've gotten creative. So initially our program, the goal was to engage people prior to leaving jail. So starting the assessment process, getting their housing applications done, meeting their case manager, counselor, and even begin looking for housing, possibly even in an ideal world, placing them into units prior to leaving jail. But then we stopped being able to go to the jails to visit clients. So what we've been doing is receiving the referrals from our probation officers, jail liaisons, frontline service staff, which is the agency that I work for. And really, I mean, anyone can make a referral, but those are our most frequent referral sources. We review the criteria, and what we're looking at is people who are the highest utilizers of the homeless system, frequent hospitalizations, particularly for mental health reasons, and frequently in and out of incarceration. Once we determine that they are eligible, we reach out to the referent, schedule a time to complete their mental health assessment, and complete their housing application. Once we get that completed, our partners, Eden, who are the housing agency in our area, do a housing orientation to really review the benefits of the program, the rules of the program, and it's really to help assess what skills individuals are going to need once they're in housing, because we know a lot of our clients who have never had independent housing before don't know how to cook on their own, clean, and we want to assess their ability to do those things so that we can set them up for success. We complete the housing orientation right now by phone. We start looking for housing then. So the Eden caseworker and our case manager begin looking for housing. It is with independent landlords, so we don't have high-rise buildings that all of our clients are going into. We have someone at Eden who does landlord recruitment, and so working with individuals to educate them on the benefits of helping people who are maybe at a greater need for housing supports. and getting their buy-in so that we have more of a landlord population to work with. We began looking based on client preferences and, of course, where they can legally live, because we do take people with all backgrounds. So we do take individuals with sex offenses of all tiers, which, of course, are more challenging to house. Once the housing is identified, Eden goes through an inspection process following the HUD requirements. The individual signs the lease, gets the keys. We move them in with furniture, assistance, household items once they get those keys. Go to the next slide. Some of the barriers that have happened with COVID, prior to this, we transported all of our clients and frequently, and so now we are not transporting clients, but we do offer assistance with bus passes. We could even do like cab vouchers if necessary. Medicaid offers transportation, so we're working more frequently with insurance companies and also building up those like family support systems for some of our individuals who actually have the support systems still intact. Landlords have been hesitant to allow individuals to visit apartments. That was especially in the beginning of the pandemic, and so we are doing some more video visits with landlords, or sometimes case managers are going to look at the unit and showing pictures to our individuals who are in the program, just to kind of work around that challenge. The eviction ban, which has been really great for our clients, has actually caused kind of a dearth of housing availability. So we have significantly fewer units are available. So while I'm very happy there is an eviction moratorium, it is causing some challenges with finding new housing. And then again, just not being able to meet with clients in jail in the beginning of the pandemic, although now our county jail has a really nice video visitation set up, and so we're seeing individuals at least a couple of times a month down there. And if we have a new client who's in jail, we're now able to do the video visitation, the assessment, and the application all at that time. So how do we select individuals for this program? Of course, there's a lot of people who meet the criteria of high utilizers. So we developed this scoring tool to target the individuals with the most need. So we are looking at 3 areas: incarceration, hospitalizations, and homelessness. The thought process behind the tool was we don't want to focus just on incarcerations in the last year, because initially it was, okay, 3 or more times being in jail. But then we realized a lot of our individuals, because they are in poverty, they are not able to get bail, are in jail for long periods of time. So they might be in jail for 6 to 8 months, and they might still meet the other criteria for the program. So we didn't want to only focus on the amount of incarcerations, but also the duration. We did consider adding a length of homelessness other than just that they are homeless. We're still kind of taking that into consideration, but currently, as you can kind of see on this slide, we have points assigned for the frequency of incarceration, the duration of incarceration, the amount of hospitalizations, and then if someone is doubled up or couch surfing has 1 point, and currently in shelter on the streets is 2 points. Just in my experience, as we've been taking referrals onto the program and onboarding, we're noticing that people really with a score of 3 or more are the ones where we've been getting referred and taking onto the program. We have monthly meetings with our stakeholders to identify who is going to be prioritized. And so every month we meet with probation officers, jail liaisons, the staff at Frontline, and our funders to look at our referrals, look at the prioritization, and determine if they would be a good fit for the program. We really want to stay true to the purpose of the program and not take, for lack of a better word, like easy individuals. We want to find the people who need this program the most. You can go to the next slide. So this program, it is a pilot program. We have 15 housing vouchers. The ramp up has been a little bit slow, I think, mostly due to COVID. We have currently housed 4 individuals, 3 in housing location, and we're continuing to take new referrals. We just onboarded 2 new people this week. So we're working with Eden to get those individuals housed as quickly as possible. Some people are more able to look for housing on their own, and so sometimes those get housed a little bit quicker, but our case manager also works closely. We try to kind of design it similar to an ACT program with the frequency that we're seeing the individuals, so that we're seeing them 2, maybe 3 times a week because of their high need status. Go to the next slide. So I just have a couple of case studies I want to go over. So these are 3 of the individuals who've been housed on the program so far and who've been in the program since March and April. So SR, diagnosis of schizophrenia, in the last year, 3 incarcerations, 3 hospitalizations, and he was homeless upon release. He was admitted in March. He found housing pretty quickly. He was housed in May. He actually completed his probation, which was really exciting, at the end of May. And since he's been housed, we've had no hospitalizations, no arrests. He has been really involved with his church and family. I found out last week when I saw him that he's actually attending classes at our local community college, and he's finally agreed to a payee, which has been kind of a painstaking process. So he's been doing really well. GF, his depression, major depression with psychosis, and he has cocaine use. In the last year, 3 incarcerations, and he had been in jail for over 6 months, and he was released to homelessness as well. He was admitted in March. He was housed in May, but like so many of the individuals we work with, he did have some setbacks. He seemed to have a relapse and was accused of stealing from some neighbors' apartments. He was asked to leave the unit. We were able to prevent an eviction from the landlord because we work with this landlord frequently. However, since that happened, he's actually been in sober living for several months. And compared to when he first got on the program, we've had no recent hospitalizations, and he was in and out of the hospital probably 5 to 7 times a month in the past because of the homelessness and increase in symptoms. He's been no hospitalizations. We're working with the courts closely to make sure that he's attending all of his probation appointments. And we had some progress last week. He looked at a unit, and he actually came to us saying that he didn't think it was a good fit because of people drinking, and he didn't want it to trigger a relapse. So we were really impressed with that. So we're working on recovery with him and getting him into a new place. You can go to the next slide. And then KT, he's one of our toughest clients, one of my favorites. But he's challenging to work with because he has a lot of agitation and paranoia towards staff. His diagnosis is schizophrenia, cocaine use disorder, 3 incarcerations in the last year, and over 15 psych hospitalizations. So that's psych admissions. And it's often because of the paranoia and the delusions that he gets hospitalized. He was admitted in March. He does have a sex offense, so it's a little harder to find him housing. We have since found him housing. He was housed in August. And he was just so excited to move in. His demeanor completely changed. He talked about also wanting to finish his college degree and just feeling like now he has a place to stay, that he can make so much more progress. We've had some ups and downs since then, but he is still stably housed, which is really exciting.
And, you know, what I kind of wanted to say is within our mental health court, when we were kind of coming together to kind of talk about these clients that we knew were cycling through our court so much, there was gaps in our system where they kept falling through in terms of trying to obtain permanent supportive housing. They could never obtain the HUD definition and the amount of days because they were going in and out of our county jails so much. When Rachel went over the second individual, that is a person that has about 25 court cases, has been in the mental health court even before it began, and we know him quite well. And to see this progress that he's made with them in just the past few months has been great. And something that within our population, within our mental health court, we knew that we needed to better serve these individuals because they were falling through the different cracks. We also realized that we knew that our returning home was going to be a small pilot of high utilizers, and that also obviously cost a lot of money. But at the same time, we knew that there were other individuals throughout our court system that were returning to homelessness while they were leaving jail after either serving time or they were on pretrial and were homeless and maybe had nowhere to go. So part of our project was to include a jail shelter diversion component to that. Just within mental health court, we reviewed some of our discharge planning on the 2 years prior and really saw that there was a high number of individuals that were either returning directly from jail to shelter or transitional housing. And these were folks that had social workers trying to create discharge planning. And so we knew there was a whole other population that may not have had this discharge planning that were obviously experiencing returning to homelessness. With that, we decided to partner with the Cleveland Mediation Center to incorporate shelter diversion and mediation techniques when discharge planning for individuals who may be homeless, unstable housing, or leaving into some type of transitional housing. And really, we felt like the short-term interventions and the research that have been done on them would create long-term impacts. So our target population for this part of the project is any individuals that are on pretrial or probation that are currently in jail and are reporting that they would return to homelessness. Our jail diversion specialist will meet with that client, help them to identify possible housing, empower the client, and even assist with any landlord or family disputes, and try to create a warm discharge handoff. This part of the project started pretty much about at the beginning of March, and then COVID hit. So we've obviously struggled with some of the access to jail, but we're continuing to work on this project over the next year or two, and excited to see what the outcomes are.
And thank you, Megan and Rachel. I greatly appreciate it. So I know we're approaching the half hour. So I'll try to at least get one question for our friends in Colorado and our friends in Cuyahoga. We'll see end up from there. We appreciate all your time today for those who have a hard stop at 3:30. So first, for Zach and Carla, we had a question come in about background checks and whether there are any background checks as they relate, I believe, to tenant-based vouchers.
Great question. So for individuals to get into the program for tenant-based vouchers, we don't have any criminal background checks, but I think what we've come up with is a process for adding individuals to the household that is pretty smart. In order for an individual to be added to the household, they need to go through a criminal background check. They don't have to pass that criminal background check, but the results of the criminal background check need to be shared with the head of household so they can make an informed decision. So it sort of protects our head of household who is referred through the process so they can make an informed choice about who they add.
That's really interesting. Thank you, Zach. And first question for Cuyahoga. This question came in about landlords. They asked, how are you convincing landlords to accept housing vouchers, period, especially for individuals with criminal histories? And in this situation, they explained that they may be unique because they have a very highly competitive rental market in which landlords can make more money with tenants who are paying privately rather than vouchers.
Yeah, I think that's a really great question. I think we do definitely have some challenges. The biggest push that our housing provider, Eden, gives to landlords is that they will consistently be paid. So a lot of our individuals on the program don't have any income, and so the full amount of income is coming from Eden, so they will get their rent every single month if they have a permanent voucher, and that's indefinitely. And then also just showing them the successes. So we do talk about how these individuals have support from the frontline case manager who will frequently go out to the homes to make sure that the individual is complying with the terms of the lease. And so not only do they have like consistent rent payments every month, but also support from the community to make sure that the person is meeting the terms of the lease and not causing too many issues. The bigger challenge is once someone has had someone in the program who doesn't do well, is correcting that is hard, but gaining landlords is not quite as much of a challenge.
Yeah, I want to echo, we found the exact same thing in Colorado, that right, a typical tenant doesn't have the level of supports that a voucher holder hopefully has, which makes them more competitive. Also, we also will do things like double deposits, and then not every rental subsidy can do this, but since we created a rental subsidy, I think this is really great. We created a damage payment that was available and could be accessed mid-lease to cover damages, because right, we're going to pay that payment anyway. Why don't we make it available mid-lease if the tenant causes the damages, so that we can avoid an eviction and maybe fix some holes in the walls or something like that. Just, again, creating as little risk for the landlord as possible.
And those, it sounds like a really innovative way to have a small investment, but that really has a really big impact for folks. So another question around Colorado's permanent supportive housing, if you could tell us a little bit more about the funding for that initiative.
Yeah, so marijuana tax cash fund dollars. So we legalized marijuana, I don't know if you've heard, in Colorado. And so we made a decision to use that funding specifically to strengthen our homeless services continuum of care and invest in best practices. So really using those marijuana tax cash fund dollars, because they are state funded, we can do all sorts of creative things that we're unable to do with federal resources. But then also, use those federal resources, but plug those gaps that exist in the continuum of care using those state resources. So marijuana tax cash fund, if your state has legalized marijuana, definitely advocate for that as a use for those dollars. Marijuana revenue is not, going to totally balance your state's budget by any means, but it is at a level, and it is somewhat controversial to use those funds for that purpose, right? Because maybe you're insinuating that marijuana is connected with homelessness, and some folks don't feel comfortable with that, and I totally understand that. But we were still able to say, let's use these funds for this purpose. Don't try and use marijuana dollars to pay for roads or infrastructure costs like that, but use them for a very specific targeted program where you can show those great outcomes, but there's not a lot of funding for that purpose in a lot of states right now.
Yeah, thank you, Zach. And on back to Cuyahoga, had a question about how was Returning Home Cuyahoga started, and how was it built to capacity? Maybe just expanding a little bit about what I had explained previously.
Sure. So we were able to utilize funding from the state level from our Department of Corrections. They have TCAP money, which is money they'll provide on the local level to common pleas courts in order to use those monies towards enhancing supervision of defendants and or providing treatment. So because of that availability of money, we were able to utilize that to create this project. It is a pilot project. We did start small at 15 in order to show the progress that we're expecting, because we know that we've seen it on the state level, and then utilize that funding moving forward along with a ability to show results, so we can, eventually find other sustainable funds, across the state or the county levels in the future also.
Yeah, thanks. And I know that that's something that Stepping Up Ohio and Sally Lucan and the Justice Center here, although we've thought it's been a really interesting use of those funds. So really interested to see both examples really of how funding is taking place. And one general question that had come in is if either group if you're aware of any programs like either program, but if any programs like this might exist in Minnesota. And from my own perspective, I haven't yet come across an example, but because I haven't come across it doesn't mean that it's not existing. So.
This is Zach with Colorado, and I'm going to jump off after this, but I want to say that, partnering with your local continuums of care is super critical, right? HUD breaks up the entire United States into what they call continuums of care, and each state is broken up into those continuums of care. And so they have a priority and resources, limited resource, federal resources, to serve individuals experiencing homelessness. And so if you can, those are some local resources, and those are great partners to think about partnering with as you build out your continuum of care to serve individuals with justice system involvement. It's just a question of bringing in those resources at the state level and connecting them with those experts who really know what best practices are for ending homelessness, but just adding that justice system component to that. Awesome. Thanks.
And Thomas, just to piggyback off of that, we really utilize our experts at our continuum of care and really brought them into the fold when we were talking about this, because they are the experts and they understand the resources out there, and they're working on large projects throughout our county. And I think having their support and their understanding of it was really helpful to us when we were talking to our criminal justice folks about it. So I would encourage individuals to reach out to their COCs and start making sure that they're having that relationship with them.
Great, thank you, Megan. And we'll have just one last question and then we'll wrap up. So for the Cuyahoga team, does the question come in about whether Return Home Cuyahoga helps people get enrolled in Medicaid if they're eligible?
Yes, so all of the clients in the program have a case manager, and so one of the first things we do is run their Medicaid and put an application in to our benefits department. Sorry.
Oh, no worries. I think these days that has happened to all of us, I'm sure.
Yes,
yeah,
definitely.
we appreciate, I greatly appreciate that and those connections to Medicaid. So thank you all for joining us today for our webinar. And again, this webinar will be posted to our website following, and the slides will be made available. Again, thank you all so much for joining us today, and have a great rest of your day.